Okinawa Prefecture, April 23, 1945, 1,430 hours. Captain Takeshi Nakamura of the Imperial Japanese Army's 32nd Infantry Regiment stands among the rubble of what was once a defensive position on Kakazu Ridge, his uniform torn and blood-stained, watching American Marines establish a perimeter around 200 captured Japanese soldiers. Nakamura has spent the last 3 years teaching his men that capture means dishonor worse than death, that the Americans torture prisoners, that surrender is betrayal of the emperor and family. What Captain Nakamura cannot possibly know, what no Japanese officer could imagine in their most fevered dreams, is that within 48 hours he and his men will be treated in American field hospitals with a level of medical care that exceeds what the Imperial Japanese Army provides its own officers, care so advanced and humane it will shatter everything he believed about his enemy in his own military's teachings. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow, I've saved something extra special for you. The Japanese military's indoctrination regarding capture and treatment of prisoners comes from years of systematic propaganda and the rigid Bushido Code as interpreted by Imperial General Headquarters. From the moment recruits enter training, they are taught that capture equals eternal shame, that enemy forces will torture and execute prisoners, and that the only honorable outcome in battle is victory or death. Lieutenant Colonel Hideaki Yoshida, commanding officer of the 14th Infantry Training Battalion at Kumamoto, has drilled thousands of recruits with the same message delivered to every Japanese soldier since 1941. The enemy knows no mercy. They will mutilate your body, desecrate your spirit, and bring endless shame to your family. Death in battle honors the emperor. Capture dishonors everything you hold sacred. This indoctrination proves so effective that Japanese soldiers routinely choose suicide over surrender, even when badly wounded. The infamous banzai charges, where wounded men strap grenades to their bodies and throw themselves at American positions, stem directly from this teaching. Private First Class Hiroshi Tanaka, a conscript from Hokkaido serving with the 89th Regiment, carries a grenade specifically designated for suicide should capture become inevitable. He has written farewell letters to his family, sealed and kept in his pack, assuming that death in battle represents the only acceptable outcome. The concept that he might survive the war as a prisoner never enters his mind because his training has convinced him that American captivity means torture followed by execution. Japanese military medical doctrine reflects this same philosophy of expendability and minimal care. Field hospitals in the Imperial Japanese Army consist of primitive aid stations where doctors with limited supplies perform only the most basic procedures. Wounded soldiers who cannot return to combat within days are often left to die or given minimal morphine while being told to accept their fate honorably. Major Kenji Watanabe, Chief Medical Officer of the 24th Division, operates a field hospital on Okinawa where supplies are so limited that he must reuse bandages, perform amputations without anesthesia, and make daily decisions about which wounded men receive treatment and which are told to prepare for death. The Japanese military views elaborate medical care as wasteful, believing that soldiers should endure pain without complaint and accept death as part of their service. Preparing and narrating this story took us a lot of time, so if you are enjoying it, like this video, it means a lot to us. Now back to the story. The contrast with American military medical doctrine could not be more extreme. The United States Army Medical Corps, under the leadership of Surgeon General Norman Kirk, has developed the most sophisticated battlefield medical system in human history. By April 1945, American military medicine can move a wounded soldier from the front lines through multiple levels of care, including field aid stations, battalion aid posts, collecting stations, clearing stations, field hospitals, evacuation hospitals, and general hospitals, with each level providing increasingly advanced treatment. The entire system is designed around a single revolutionary principle that would seem incomprehensible to Japanese military planners: every soldier's life has value and deserves maximum effort to preserve it. Colonel James Harrison, commanding officer of the 96th Evacuation Hospital on Okinawa, oversees a medical facility that would astonish any Japanese officer who witnessed its operations. The hospital occupies dozens of large tents equipped with electric lighting powered by generators, surgical tables with proper lighting and instruments, X-ray machines for diagnosing fractures and internal injuries, blood plasma for transfusions, sulfa drugs, and the new miracle drug penicillin for fighting infections, and trained surgeons, nurses, and corpsmen who work around the clock to save lives. The facility can perform over 100 surgeries daily, treating everything from minor wounds to complex abdominal and thoracic procedures that would be considered impossible in Japanese field hospitals. The American military's commitment to medical care extends to an elaborate evacuation system that prioritizes rapid treatment. Wounded men are removed from the front lines by trained corpsmen who provide immediate first aid, then transported to battalion aid stations within minutes by jeep ambulances or tracked vehicles modified to carry stretchers. From battalion aid stations, patients move to collecting stations where doctors perform triage, determining which cases require immediate surgery and which can wait. Seriously wounded men are then evacuated to field hospitals within hours of being injured, transported by ambulance or even aircraft when necessary. This entire system operates on the principle that rapid treatment dramatically improves survival rates, a concept the Japanese military has never seriously implemented. Captain Nakamura's understanding of American military medicine comes entirely from propaganda distributed by Imperial General Headquarters. Japanese soldiers have been told that American doctors experiment on prisoners, that wounded captives are left to die without treatment, and that Americans view Japanese soldiers as subhuman creatures unworthy of medical care. These lies are reinforced by cherry-picked examples of American war crimes or isolated incidents of poor treatment, presented as standard American practice. The Japanese propaganda machine has created an image of American forces as barbaric monsters who take pleasure in causing suffering, making surrender seem like accepting torture rather than receiving care. The reality that Captain Nakamura is about to encounter began taking shape long before the Okinawa campaign. In field hospitals throughout the Pacific Theater, American medical personnel have been treating wounded Japanese prisoners with the same care provided to American casualties, following Geneva Convention protocols and basic medical ethics even though Japan never ratified the Geneva Conventions and provides no reciprocal treatment to Allied prisoners. Lieutenant Commander Sarah Mitchell, chief nurse at the 38th Field Hospital on Saipan, established protocols in July 1944 for treating Japanese wounded that prioritize medical need over nationality, despite fierce resistance from some combat personnel who view this as coddling the enemy. The medical supplies available to American forces represent another shocking contrast with Japanese capabilities. By 1945, American military hospitals stock medications and equipment that seem almost magical compared to what Japanese doctors have available. Penicillin, mass-produced in American factories and shipped to the Pacific in refrigerated containers, can cure infections that would mean certain death in Japanese hospitals. Blood plasma, collected from millions of American civilian donors and processed in sophisticated facilities, allows American surgeons to replace blood loss during surgery and treat shock, capabilities Japanese military medicine lacks entirely. Sulfa drugs prevent wound infections. Morphine syrettes provide pain relief. Whole blood transfusions save lives that would be lost to hemorrhage. The surgical techniques employed by American military doctors also far exceed Japanese capabilities. American military surgeons have been trained in the latest procedures at institutions like Walter Reed Hospital and Johns Hopkins, learning techniques for repairing damaged organs, reconstructing shattered bones, and performing delicate vascular repairs. These surgeons operate with proper lighting, sterilized instruments, anesthesia provided by trained nurse anesthetists, and post-operative care that includes monitoring vital signs, administering antibiotics, and managing pain. Japanese military surgeons, by contrast, often operate in near darkness with improvised instruments, no anesthesia beyond sake or minimal morphine, and post-operative care that consists primarily of hoping the patient survives. The American military's investment in medical care reflects fundamental differences in how the two nations view their soldiers. American military doctrine, influenced by democratic values and recognition that trained soldiers represent significant investment, treats casualties as recoverable assets who should receive maximum effort to return them to health. The elaborate medical system exists because American military planners understand that good medical care improves morale, reduces preventable deaths, and ultimately produces better military outcomes. Japanese military doctrine, influenced by feudal concepts of expendability and belief in spiritual strength overcoming physical limitations, treats casualties as inevitable losses whose suffering should be endured stoically rather than mitigated through elaborate medical intervention. Captain Nakamura's journey from combat to captivity begins in chaos and confusion. As American forces overrun his position, he makes the agonizing decision to surrender rather than commit suicide, motivated partly by wounds that make suicide difficult and partly by a sudden desperate desire to survive despite years of conditioning. The moment he raises his hands in surrender, he expects immediate execution or beating, scenarios his training promised would follow capture. Instead, an American Marine corporal named Davis approaches cautiously, weapon ready but not threatening, and signals for Nakamura to move toward a collection point where other prisoners are being assembled under guard. The first shock comes within minutes of capture when an American Navy corpsman named William Chen begins examining Nakamura's wounds. Chen, a Chinese-American medic from San Francisco who speaks some Japanese, approaches with a medical bag and begins cleaning the shrapnel wounds on Nakamura's arm and leg. The corpsman works efficiently but gently, applying sulfa powder to prevent infection, wrapping clean bandages, and offering water from his canteen. This simple act of providing medical care to an enemy soldier contradicts everything Nakamura has been taught about American brutality. He watches in stunned silence as Chen moves from prisoner to prisoner, treating wounds without regard to rank or severity of injuries, following the same triage protocols used for American casualties. The collection of Japanese prisoners continues throughout the afternoon as American forces consolidate their positions. By evening, nearly 300 captured Japanese soldiers, including Nakamura, are assembled in a secured area behind American lines. Guards watch carefully but make no attempt to abuse or humiliate the prisoners. Several prisoners, badly wounded and unable to walk, are carried on American stretchers by American personnel, an act of consideration that leaves the Japanese soldiers confused and suspicious. Sergeant Masao Fujita, a veteran of campaigns in China and the Philippines, whispers to Nakamura that this must be a trick, that the Americans are being kind now only to make torture more psychologically devastating later. The reality becomes impossible to deny when American medical personnel begin evacuating seriously wounded prisoners to field hospitals. Captain Nakamura, whose wounds are deemed serious enough to require surgical attention, is loaded onto a Jeep ambulance along with 4 other wounded Japanese soldiers and 2 wounded Americans. The ambulance driver, a young private from Iowa, drives carefully over rough terrain, trying to minimize jolts that might cause pain to his patients. The American wounded converse quietly with each other, occasionally glancing at the Japanese prisoners but making no threatening gestures. This casual proximity between enemies, traveling together to receive medical care, creates a cognitive dissonance that leaves Nakamura struggling to reconcile what he is experiencing with what he was taught to expect. The 96th Evacuation Hospital comes into view just before sunset, a sprawling complex of large tents marked with enormous red crosses painted on white backgrounds. The facility bustles with activity as ambulances arrive, personnel rush between tents, and the organized chaos of military medicine in wartime unfolds. Nakamura and the other Japanese wounded are unloaded at a receiving tent where American medical personnel perform triage, examining each patient and assigning priority for treatment. A doctor named Captain Robert Sullivan examines Nakamura's wounds, checking for signs of infection, assessing the shrapnel damage, and consulting briefly with a nurse before marking Nakamura's chart for surgery within the next few hours. What strikes Nakamura most forcefully is not just that he is receiving medical care, but that he is receiving the same care as American casualties. In the preoperative tent, Japanese wounded lie on cots next to American wounded, all receiving identical attention from medical personnel who move between patients without apparent distinction based on nationality. A nurse named Lieutenant Mary O'Connor checks Nakamura's vital signs, ensures his intravenous line is flowing properly, and offers him morphine for pain. She speaks to him in simple English supplemented with hand gestures, treating him with professional courtesy despite the language barrier and despite knowing he fought to kill Americans just hours earlier. The preoperative care includes procedures that seem almost luxurious compared to Japanese military medicine. Nakamura receives clean hospital pajamas to replace his torn, blood-stained uniform. His wounds are cleaned again with antiseptic solutions. He is given water to drink and a small amount of broth, the first real food he has eaten in days. The cot beneath him has clean sheets, a mattress that provides actual comfort, and a pillow that supports his head. These simple amenities, taken for granted by American medical personnel, represent comforts that Nakamura has not experienced since leaving Japan nearly 3 years ago. Japanese field hospitals provide wounded men with straw mats on the ground if they are lucky, no cushioning if they are not. As evening turns to night, Nakamura lies on his cot listening to the sounds of the hospital around him. He hears doctors conferring about cases, nurses speaking softly to patients, the hum of generators providing electricity, and occasionally the sound of ambulances arriving with more casualties. The efficiency and organization of the facility impresses him despite his confusion about why Americans would invest such resources in medical care. In his experience, military hospitals exist primarily to return lightly wounded men to combat quickly, not to provide elaborate care to all casualties regardless of severity. The cognitive dissonance intensifies when Nakamura observes how American medical personnel treat Japanese prisoners who are conscious and able to communicate. A Japanese soldier in the cot next to his, a young private named Yuki Matsumoto who speaks a few words of English learned before the war, asks a passing nurse for water. The nurse, without hesitation or contempt, fills a cup and helps Matsumoto drink, supporting his head gently because his arm is immobilized. This simple act of human kindness toward an enemy soldier contradicts years of propaganda about American barbarity. Matsumoto, like Nakamura, seems unable to process what is happening, his face showing the same mixture of confusion and disbelief. The transformation in Captain Nakamura's understanding begins subtly as he waits for surgery. He observes American medical personnel working with dedication that seems genuine rather than performed for propaganda purposes. He watches doctors making rounds, checking on patients, adjusting treatments based on each individual's condition. He sees nurses providing care that goes beyond medical necessity, offering comfort and reassurance to frightened wounded men regardless of their nationality. He witnesses corpsmen cleaning and bandaging wounds with attention to detail that suggests they actually care about preventing infection and promoting healing. What Nakamura cannot yet comprehend is that he is witnessing the results of a medical philosophy fundamentally different from anything in his experience. The American military medical system operates on principles of triage based on medical need, treatment based on best available science, and care based on recognition of common humanity. These principles, codified in training, reinforced through military regulations, and practiced by medical personnel who take professional ethics seriously, create outcomes that seem impossible to observers from militaries that do not share these values. As Nakamura's turn for surgery approaches, a medical officer comes to explain the procedure through a Japanese-American interpreter attached to the hospital. The doctor, Major Thomas Chen, describes in simple terms that Nakamura has shrapnel fragments in his leg that need to be removed to prevent infection and permanent damage. The surgery will be performed under anesthesia so Nakamura will feel no pain. Afterward, he will receive antibiotics to prevent infection and pain medication to manage discomfort during recovery. Major Chen speaks matter-of-factly, as if treating enemy wounded with sophisticated surgery were the most natural thing in the world rather than an act of generosity that exceeds anything Nakamura has experienced from his own military. The operating room itself represents technology and capability that Nakamura has never seen in Japanese military medicine. Bright electric lights illuminate the surgical field. Sterilized instruments are arranged on tables. An anesthesia machine stands ready to deliver carefully controlled amounts of ether. Nurses and surgical technicians prepare the space with practiced efficiency. Major Chen scrubs his hands with antiseptic soap at a proper surgical sink, following protocols designed to prevent infection. Everything about the setup suggests that the Americans take surgery seriously as a scientific procedure requiring proper conditions and equipment, not as a desperate improvisation performed under primitive conditions. As Nakamura is wheeled into the operating room, he experiences a moment of pure terror, wondering if this is when the torture his training promised will begin. Instead, the anesthesiologist, a captain named Morrison, places a mask over Nakamura's face and tells him to breathe normally. The smell of ether fills Nakamura's nostrils, and within seconds, consciousness fades into darkness. His last thought before anesthesia takes him is that this cannot be real, that everything he is experiencing contradicts everything he knows about war, enemies, and his own military's teachings. Captain Takeshi Nakamura regains consciousness slowly, his mind foggy from anesthesia, aware first of an absence of pain that seems impossible given his memories of shrapnel wounds. He opens his eyes to find himself in a recovery ward, lying in a proper hospital bed with clean white sheets, his leg elevated and wrapped in fresh bandages. A glucose drip feeds into his arm through an intravenous line. The tent around him contains dozens of other beds, some occupied by American soldiers, others by Japanese prisoners, all receiving identical post-operative care from nurses who move between patients checking vital signs and adjusting treatments. The surgery Captain Nakamura underwent would have been impossible in any Japanese military hospital he has ever seen. Major Thomas Chen and his surgical team spent 90 minutes carefully removing 7 pieces of shrapnel from Nakamura's leg, repairing damaged muscle tissue, and ensuring no fragments remain that might cause future infection. The procedure was performed under full anesthesia with proper sterile technique, using surgical instruments that were actually designed for the procedures rather than improvised tools. The wound was then thoroughly irrigated, packed with sulfa powder, and closed with careful suturing designed to minimize scarring and promote proper healing. This level of surgical care represents technology and expertise that exceeds what the Imperial Japanese Army provides to its own generals, let alone captured enemy soldiers. The post-operative care proves equally impressive. A nurse named Lieutenant Patricia Reynolds checks Nakamura's vital signs every 2 hours, recording his temperature, pulse, blood pressure, and respiration rate on a detailed chart. She examines his wound for signs of infection, changes his bandages using sterile technique, and administers penicillin injections every 4 hours to prevent bacterial infection. When Nakamura indicates pain through facial expressions, Reynolds provides morphine in carefully measured doses, managing his discomfort without oversedation. This attentive nursing care, standard practice in American military hospitals, represents a level of medical attention that Nakamura has never experienced even as a Japanese officer receiving treatment from his own medical corps. The cognitive dissonance that began before surgery intensifies as Nakamura spends days recovering in the American hospital. He observes American medical personnel treating Japanese prisoners with genuine professionalism rather than performative kindness designed for propaganda. He watches doctors making morning rounds, examining each patient regardless of nationality, adjusting medications based on individual responses, and making treatment decisions based solely on medical criteria. He sees nurses providing care that extends beyond clinical necessity, offering comfort to frightened patients, helping those who cannot feed themselves, and treating everyone with basic human dignity. Private First Class Yuki Matsumoto, recovering in the bed next to Nakamura's, provides another perspective on the shocking reality of American medical care. Matsumoto, who lost his right arm to an American artillery shell, underwent an amputation surgery that saved his life and was performed with techniques designed to create a viable stump that might eventually accommodate a prosthetic limb. The American surgeon who performed the procedure, Lieutenant Colonel David Harrison, explained through an interpreter that the amputation was necessary but was done in a way that would give Matsumoto the best possible quality of life after healing. This consideration for a prisoner's future well-being, planning for life after the war rather than simply keeping him alive until he could be interrogated, represents a mindset that neither Matsumoto nor Nakamura can fully comprehend. The hospital ward becomes a classroom where Japanese prisoners receive an education in American values through direct observation rather than lectures. Sergeant Masao Fujita, who survived multiple wounds during the battle, spends his recovery time watching how American medical personnel interact with each other and with patients. He observes that nurses speak to doctors with professional respect but without the rigid hierarchy that characterizes Japanese military interactions. He sees enlisted corpsmen making medical decisions within their scope of training without requiring officer approval for every action. He witnesses a medical system that functions through competence and training rather than strict adherence to rank-based authority, a model that challenges everything he understands about military organization. The food provided to recovering patients represents another shocking contrast with Japanese military provisions. American military hospitals serve meals designed to promote healing, including protein-rich foods, vegetables, fruits, and adequate caloric intake to support recovery. Breakfast might include eggs, toast, orange juice, and coffee. Lunch could feature meat, potatoes, vegetables, and dessert. Dinner provides similar nutritional value with variety to prevent menu fatigue. These meals, standard fare in American military medical facilities, exceed the quality and quantity of food that Japanese soldiers receive even in peacetime garrisons, let alone in combat zones where rations have dwindled to rice and occasional fish. Lieutenant Hiroshi Saito, a junior officer recovering from abdominal surgery, finds himself confronting a philosophical crisis as he compares his treatment in American captivity with his experiences in the Japanese military. Saito remembers field hospitals in China where wounded soldiers were given minimal morphine and told to endure suffering silently as demonstration of martial spirit. He recalls doctors in the Philippines who performed amputations without anesthesia because supplies were limited and pain endurance was considered character building. He has personal experience with Japanese military medical doctrine that views elaborate treatment as wasteful coddling that weakens soldiers' resolve. Yet here, in enemy captivity, he receives pain medication whenever he needs it, surgical care that prioritized his long-term health, and nursing attention that treats his comfort as a legitimate medical concern. The presence of Japanese-American medical personnel adds another layer of complexity to the prisoner's experiences. Staff Sergeant James Tanaka, a Nisei interpreter and medical assistant from California, works throughout the hospital helping translate between medical staff and Japanese patients. Tanaka's family was interned in Manzanar while he volunteered for military service, demonstrating loyalty to America despite unjust treatment. His willingness to help enemy Japanese soldiers receive medical care, despite his own family's suffering, provides a living example of American ideals about separating individuals from their government's actions. Tanaka speaks to Japanese prisoners not with hatred or superiority but with professional courtesy, explaining treatments, translating questions, and facilitating communication that improves medical outcomes. The psychological impact of this treatment extends beyond individual prisoners to affect their fundamental worldview. Captain Nakamura, lying in his hospital bed with time to think, begins questioning everything he was taught about the enemy and about his own military's values. If Americans are barbaric monsters who torture prisoners, why is he receiving better medical care than he ever received from his own army? If Japanese military doctrine correctly assesses American character, why do these nurses and doctors treat enemy wounded with the same dedication they show toward their own casualties? If Bushido represents the highest form of military virtue, why does it result in wounded soldiers dying on straw mats while American medical ethics produces sophisticated hospitals that save lives? These questions trouble not just Nakamura but hundreds of Japanese prisoners recovering in American medical facilities throughout the Pacific Theater. Private Kenji Yamamoto, a conscript from rural Kyushu with limited education, struggles to reconcile his direct experiences with years of propaganda. He was taught that Americans view Japanese as subhuman. Yet the nurse who changes his bandages, Lieutenant Sarachin, treats him with the same gentle care she provides to American patients, checking his comfort, managing his pain, and speaking to him with basic human kindness despite the language barrier. This contradiction between propaganda and reality creates cognitive dissonance that Yamamoto cannot resolve within his existing belief system. The efficiency and organization of American military medicine impresses even Japanese medical personnel who become prisoners. Captain Ichiro Hayashi, a doctor who served with the 32nd Infantry Regiment before capture, spends his recovery time observing American medical procedures with professional interest. Hayashi notices that American hospitals maintain detailed records for every patient, tracking treatments, medications, surgical procedures, and recovery progress. He observes standardized protocols for wound care, infection prevention, and pain management. He witnesses a supply system that ensures adequate availability of medications, bandages, instruments, and equipment. This systematic approach to military medicine, based on scientific principles and organizational efficiency, contrasts sharply with the improvised, supply-constrained Japanese military medical system where doctors make do with whatever materials are available. The psychological preparation for repatriation begins even during medical recovery as American personnel recognize that Japanese prisoners will eventually return home carrying memories of their treatment. Military intelligence officers conduct interviews with prisoners, not through torture or coercion but through patient conversation facilitated by interpreters. These interviews focus on gathering military information but also serve an unintended purpose of demonstrating American values. Lieutenant Colonel Michael O'Brien, an intelligence officer attached to the hospital, conducts interviews that show respect for prisoners' dignity, accept refusals to answer certain questions without punishment, and treat information provided as intelligence rather than coerced confession. This approach to interrogation, based on building rapport rather than instilling fear, produces better intelligence while also creating favorable impressions of American military conduct. The presence of female nurses in military hospitals provides another cultural shock for Japanese prisoners. The Imperial Japanese Army does not employ female medical personnel in combat zones, viewing battlefield medicine as inappropriate work for women. Yet American military hospitals employ thousands of female nurses who serve with dedication and professionalism in dangerous forward areas. Lieutenant Mary O'Connor, a nurse from Boston who has served in the Pacific for 18 months, treats wounded Japanese prisoners with the same professional care she provides to American casualties, viewing her duty as medical rather than political. Her competence, authority within her medical role, and treatment as an equal by male medical personnel challenges Japanese prisoners' assumptions about gender roles and women's capabilities. The gradual recovery process allows Japanese prisoners time to observe patterns in American military culture that differ fundamentally from their own experiences. Corporal Takeo Shimizu, recovering from a lead wound, notices that American enlisted men speak more freely to officers than would ever be tolerated in the Japanese military. He observes medical corpsmen making jokes during rounds, nurses questioning doctors' orders when they believe different treatment would be better, and a general atmosphere of professional collaboration rather than rigid hierarchical obedience. This cultural difference, seemingly minor, reflects fundamental distinctions in how the two militaries view soldiers, as expendable tools to be commanded versus as valuable individuals whose judgment matters. The treatment of mental health casualties provides yet another example of American military medical philosophy. Sergeant Masaru Kobayashi, who survived the battle but suffers from what American doctors call combat fatigue or shell shock, receives psychiatric treatment from Captain Arnold Klein, a psychiatrist assigned to the hospital. Klein speaks with Kobayashi through an interpreter about his experiences, symptoms, and fears, treating psychological wounds as legitimate medical conditions rather than character failures. This psychiatric attention, routine in American military medicine, contradicts Japanese military doctrine that views psychological casualties as weaknesses to be overcome through willpower rather than medical conditions requiring treatment. Kobayashi, who expected to be shamed for his psychological symptoms, instead receives compassionate care that acknowledges trauma as a normal human response to extreme stress. As weeks pass and prisoners heal, the hospital ward becomes a community where Americans and Japanese coexist under medical rather than military protocols. Recovered American soldiers sometimes visit the ward, curious about the enemy they fought. These visits, supervised by medical personnel to prevent incidents, usually result in awkward but non-hostile interactions where former enemies recognize each other's common humanity. Private Robert Johnson, an infantryman recovering from a minor wound, speaks with Private Matsumoto through an interpreter, discovering that both men were farmers before the war, both were conscripted against their preferences, and both hope to return to agricultural life when the war ends. These human connections, impossible on the battlefield, emerge naturally in the hospital's neutral medical space. The physical therapy and rehabilitation services available to recovering prisoners represent another aspect of American military medicine that Japanese observers. Soldiers receive physical therapy designed to restore function, maintain range of motion, and prevent disability. Lieutenant Grace Martinez, a physical therapist from Texas, works with Japanese amputees to teach them how to function with prosthetic limbs, with soldiers who have knee damage to maintain muscle strength, and with those who have limited mobility to prevent contractures. This investment in rehabilitation, helping prisoners regain function that will benefit them after repatriation, demonstrates American recognition that medical care should aim for maximum recovery rather than minimal survival. The preparation for transfer to POW camps brings mixed emotions for recovering Japanese soldiers. On one hand, they recognize that the intense medical care they received in the evacuation hospital will not continue indefinitely. On the other hand, they have learned that American POW camps, while certainly restrictive, do not feature the torture and execution that Japanese propaganda promised. Captain Nakamura, now ambulatory with crutches, receives a final medical examination before transfer. Major Chin reviews his surgical outcome, provides instructions for wound care, and ensures adequate pain medication accompanies him to the POW camp. This continuity of care, planning for Nakamura's medical needs beyond the hospital stay, represents a level of patient-focused medicine that exceeds Japanese military medical practice. The long-term psychological impact of this medical treatment on Japanese prisoners becomes apparent in subsequent years. Thousands of Japanese soldiers who received treatment in American military hospitals returned to Japan after the war carrying memories that contradict the propaganda they were taught. These men tell families about American doctors who saved their lives, nurses who treated them with kindness, and a medical system that valued every soldier's survival. Their testimonies, shared in communities throughout post-war Japan, contribute to changing Japanese perceptions of Americans and challenge militaristic narratives about enemy barbarism. Former Captain Nakamura, interviewed in 1952, states simply, "They treated us better as prisoners than our own military treated us as soldiers. This made me question everything I had believed about the war." The medical records created during treatment of Japanese prisoners serve multiple purposes beyond immediate care. These detailed documents, maintained according to American military medical protocols, provide evidence of proper treatment according to Geneva Convention standards. They also offer Japanese officials information about their soldiers' medical conditions when arranging repatriation. Most significantly, they demonstrate American commitment to treating all human beings with dignity regardless of nationality or wartime status, a principle that shapes post-war Japanese-American relations and contributes to the alliance that emerges in subsequent decades. The stories of individual Japanese prisoners treated in American hospitals spread through POW camps and eventually reach soldiers still fighting. Word circulates that Americans provide real medical care to prisoners, that wounded Japanese soldiers who surrender receive treatment rather than execution, and that American military medicine can save lives that would be lost in Japanese field hospitals. This information, initially dismissed as American propaganda, gains credibility as more prisoners report similar experiences. The knowledge that surrender might mean medical care rather than torture influences some Japanese soldiers' decisions in the final months of the war, potentially saving lives on both sides by encouraging surrender rather than suicidal last stands. The American medical personnel who treated Japanese prisoners carry their own memories of this experience. Lieutenant Patricia Reynolds, reflecting years later, describes the satisfaction of seeing hatred and fear in prisoners' eyes transform into confusion and then gratitude as they realized they would receive genuine medical care. Major Thomas Chin speaks about the professional obligation to treat all patients with equal dedication regardless of their nationality, politics, or role in the war. These medical personnel understood that their treatment of enemy wounded reflected American values and contributed to broader strategic goals of demonstrating that democracy treats individuals with inherent dignity. The transformation of Japanese prisoners' understanding through medical treatment represents one of the most powerful forms of cultural diplomacy undertaken during World War II. Without lectures about American values, without propaganda films or indoctrination sessions, American military medicine demonstrated through direct experience that enemy soldiers would be treated humanely, that medical care was based on need rather than nationality, and that American military personnel followed ethical principles even under wartime pressures. This demonstration proved more convincing than any propaganda because it was real, experienced directly by thousands of Japanese soldiers who had every reason to doubt American claims but could not deny the reality of the care they received. the legacy of this medical treatment extends into the post-war period in ways that shaped the Pacific region for decades. Japanese veterans who experienced American medical care firsthand became advocates for Japanese-American friendship, sharing stories that humanized former enemies and built foundations for post-war alliance. Medical professionals in post-war Japan studied American military medical techniques, incorporating innovations like standardized protocols, detailed record-keeping, and rehabilitation services into civilian healthcare. The contrast between American and Japanese military medical care during the war contributed to Japan's post-war rejection of militarism and embrace of democratic values that prioritize individual human worth. The approximately 100,000 Japanese prisoners who received medical treatment from American forces during World War II represented a small fraction of Japanese military personnel, but their experiences had disproportionate impact on post-war Japanese society. These men returned home with first-hand knowledge that contradicted wartime propaganda, that challenged militaristic values, and that demonstrated alternative approaches to medicine, military organization, and human dignity. Their stories, initially shared quietly among family and friends, eventually contributed to broader Japanese understanding of the war and acceptance of defeat as liberation from a system that valued death over life. Captain Takeshi Nakamura, now elderly and living in Yokohama, keeps a photograph from his time as a prisoner in the American hospital. The black and white image shows him recovering in his hospital bed, an American nurse checking his chart in the background. He shows this photograph to his grandchildren and tells them, "This picture represents the day I learned that my enemies were more humane than my own officers. The Americans saved my life and treated my wounds better than the Imperial Army ever did. This taught me that military propaganda lies, that former enemies can become friends, and that the true measure of a society is how it treats those who are completely powerless." This simple testimony, repeated by thousands of Japanese veterans who experienced American medical care, helped transform Pacific relations and demonstrates that even in war's darkest moments, human decency can shine through and reshape the future.